All right, so in the context of COVID, this week I want to discuss the impact of COVID and the pandemic response on our children and our teens. And I saw a TED Talk recently of a woman who was going through the research on it, and she made great points about how, we need to ask the question, when is the quote solution a bigger problem than the quote problem, right? So let's go through the research, and I think you'll understand what that means if you don't already. But this is a paper from, or a letter written into the Indian Journal of Psychological Medicine in January. And this author was discussing the escalating suicide rates among school-aged children during the pandemic and lockdown. And he starts off by saying the first sentence, globally, suicide among children is a huge problem, and so big that it's the second leading cause of death among people aged 10 to 24. And so, if we're looking to preserve the health of our children and our teens, then we need to obviously force rank the way that we're quote unquote protecting them from things. And if suicide's the number 2 killer, then we have to, work to minimize the number of suicides as much as possible. And believe it or not, COVID is not the number 1 killer of children. So COVID responses, especially as they pertain to children, need to be considered. We need to be considering the risk or the impact of the responses on suicide risk and suicide ideation when we're implementing it, because children are the lowest risk group by far. Children do not die from COVID, essentially. The few who do, I've made videos previously on this, the few who do die from what's called multi-inflammatory systemic, let me get the acronym right, multi-inflammatory syndrome, basically. Just call it that. Look up my video. But essentially the few children who die with COVID and end up having essentially cytokine storm, which is what that acronym stands for. And a recent study a couple of weeks ago came out of Harvard that showed the children that the one key differentiating factor determining the children that die from COVID because of the cytokine storm and the children who are asymptomatic and unaffected is leaky gut. And so the overall worldwide, it's well known children are the least at risk age group. So, we don't want to create a solution that kills more kids than the problem, and the problem kills very few children. And it ends up the solution that we created kills many children and is exacerbating the number 2 killer of children on the planet, which is suicide. And so this letter is this man talking about this, and he says, the COVID-19 pandemic and lockdown, the suicide tendency has significantly risen. There's been a 9 to 33% rise in the number of children presenting with self-harm injuries as well. So, there's a spectrum of self-harm all the way to suicide. So some kids might cut themselves or burn themselves or just harm themselves in some way, but not take their own lives, all the way up to taking their own lives. And these things are underreported and neglected and kind of swept under the rug. And so we just need to recognize that our children are being injured by this. And this isn't just a suicide issue. If you look at the masking research shows that, it's impacted, it's increased anxiety in children. It's led to more difficulties in school from a learning perspective. It's led to headaches and all kinds of different health complaints or health issues. And so the answer to protecting children from COVID is, hey, children don't need to be protected from COVID, and we don't need to be increasing suicide by protecting them from something they don't need protection from. So there's one study showing that. Here's another one, and this is from the American Academy of Pediatrics. So, you can't really get a bigger journal to publish a paper like this in the American Academy of Pediatrics. And the title is Suicide Ideation and Attempts in Pediatric Emergency Department Before and During COVID-19. And this study wanted to look at suicide risk during the pandemic from January and July 2020 compared to January and July 2019 pre-pandemic. So they looked at youth age 11 to 21. They looked at over 9,000 of them in that age group. The average age was 14 or almost 15, 14 and 3/4. And what they found was the months with significantly higher rates of suicide-related behaviors correspond to the times when COVID-19 related stressors and community responses were heightened. And this indicates that the youth experience elevated distress during these periods. So you may be rolling your eyes and be like, well, of course they did. We all did. And yes, that's true. But adults have more outlets in terms of dealing with stress. We can also better communicate it. And it doesn't mean we always do, but at least an adult can leave the house. A 14-year-old can't necessarily drive away. An adult can, go work out or eat comfort foods, do unhealthy behaviors, but at least behaviors that, while unhealthy, are maybe de-stressing the person. Whereas children can eat comfort food and exercise as well, but they may not have the means to do it as easily and volitionally as an adult would. So this American Academy of Pediatrics article, again, shows that in looking at almost 9,100 youths, average age 14, there was a significant increase in suicide-related behaviors, both thinking about doing it and doing it compared to non-pandemic months. So this is an issue. And again, we're doing this. We did the lockdowns partially, to protect everyone was the thinking. And we've covered quite a bit about how the lockdowns were not the best strategy as a strategy for all people. It could be a good strategy for specific age groups like 70 plus, but to do it for everybody was not the right choice. And for children especially, it wasn't, because transmission in children, the child's not to blame. So this study is also from the journal Pediatrics, and they wanted to look at transmission in children and say, do children transmit it to adults or vice versa, or is it equal? And essentially the research that this paper covered shows that children don't transmit it to adults, children get it from adults. So the children aren't to be blamed for spreading it, and therefore why close down schools? Why take them out of their day-to-day routine and add the stressors and risk the suicidal ideations and attempts when, the children aren't to blame? And we can look at a study in China that looked at 10 million people in Wuhan. Okay, Wuhan's the epicenter. Wuhan is where the virus started. And that we've covered this paper in another video, but this paper looked at 10 million Chinese who were tested. And the point of the paper was to see how is it spread, and do asymptomatic people spread it? And is there reinfection? Like, what's the risk of all this? So if you want to dive deeper into this study, I have a previous video covering this. But what I really want to focus on in this paper is the child piece. And so up here you can see they say the asymptomatic positive rate was the lowest in children or adolescents age 17 and below, and the highest among elderly age 60 and above. Okay, so, well, maybe we selectively quarantine the elderly and let the children go about their day-to-day lives, because the asymptomatic positive rate was the lowest in 17 and under. And down here we can say the citywide screening of SARS-CoV-2 or COVID in Wuhan recruited 10 million people and found no newly confirmed cases with COVID-19. The detection rate of asymptomatic positive cases was very low, and there was no evidence of transmission from asymptomatic positive people to traced close contacts. So if you had an asymptomatic positive person, they were not spreading it to their family, and especially if they were children, they were not spreading it. And the reason would be right here. Compared with symptomatic patients, asymptomatic infected people generally have lower levels of viral load and a shorter duration of viral shedding, which decrease transmission risk. So again, if children aren't going to transmit it, then why are we locking them down? Well, maybe children don't have antibodies. That's why we need to vaccinate them. Oh, okay. Let's look at this. This is a brand new study. It's actually in preprint. It hasn't even passed through peer review yet, but it's available to us. And it says the title is Asymptomatic or Mild Symptomatic SARS-CoV-2 Infection Elicits Durable Neutralizing Antibody Responses in Children and Adolescents. If we jump down here to the abstract, you can see, I'll just read it to you. We evaluated antibody responses in 69 children and adolescents with asymptomatic or mild symptomatic COVID. We detected robust IgM acute antibodies, IgG memory cell antibodies, and IgA mucosal defense antibody responses to a broad array of COVID antigens at the time of acute infection and at 2 and 4 months after acute infection in all participants. Notably, these antibody responses were associated with virus neutralizing activity that was still detectable 4 months after acute infection in 94% of the children. Okay, so children who were asymptomatic or mildly symptomatic had robust antibody responses across 3 antibody classes that were still neutralizing virus 4 months after the acute infection, 94% of children. So that is very robust and durable. Moreover, the antibody responses and neutralizing activity in the blood from children and adolescents were comparable or superior to those observed in the blood from 24 adults with mild symptomatic infection. So the children made better antibody responses than the adults. So this all adds up, for me to say, again, rather than create societal mandates or peer pressure that put our kids at further risk, like we did with lockdowns and increased suicide ideation and suicide rates, why don't we, quote unquote, follow the science and see that A, kids are the least impacted, B, when they are impacted, even asymptomatically, they make robust antibody responses, and C, when they're impacted, they don't shed it or they don't transmit it to their friends or to their family. Then why are people trying to push for mass vaccination of 17 and under, the least at-risk age group? So I would just ask you to consider that. If you're someone considering vaccinating your children, you're putting them at risk for something that is super low risk for them. So is the newest quote unquote solution just another bigger problem than the quote unquote problem?